In the holy presence of God, in the name of the Father, of the Son, of the Holy Spirit, Amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Okay, so once again, good morning everyone. Praised be Jesus and Mary.
Now and forever.
Amen. Okay, kadali lang kayo ha. I just have to answer an important call.
Sige, sir.
Okay, so I'm back. By the way, sorry Kino, I just had to attend on a very important matter. That's why I asked since last night if we could begin at around 9 para lang maasikaso na ko siya because I have to be early. Alas 8 manggod ang schedule. Now, while waiting, I hope you were able to answer the quizzes. There are 4 actually, no? Though hangtod pa man to siya karong 11. So for those who are not able to answer it yet, pag human sa to ang session, since I do not have plans on giving any TLA after our session, please work on with the quizzes for those na wala pa. So without further delay, makita man ninyo ang ato ang screen, no? Naka-share
Yes,
sa inyo
sir.
ang atong slides.
Yes,
Sige,
sir.
before ko mag-sugod, ako alang sa ning i-record ang ato ang session. Okay, so it's all set. Now, for this day, padayon na to ilailahon pa gyud si telehealth and si telemedicine, but this time around tanawon na to siya in a wider perspective. So that's why is as you can see in the slides, we will be looking into telehealth and telemedicine internationally and globally. Okay? Kumusta man ang efforts on the implementation and integration of telehealth and telemedicine in the international and global level. So muna to ang sulayan og sabot karong buntag. So for us to do that, we will cover these specific topics now for this presentation. we will try to uh, basically understand why can we say that the international and global implementation of telehealth can be considered a continuum of health services. So ato anang tanawon. And then we will also look into how can telehealth and telemedicine be of service, or how can it help in terms of education, in terms of case reviews. Okay? Not necessarily in terms of clinical services. Kapag may clinical services, ang ato ang healthcare provider will be attending to the medical needs of the patient, clinically speaking. So, like for example, katong pag-check sa iyahang sakit, and then pag-diagnose unsa gyud ang ginabati sa pasyente, ang pag-perform sa mga necessary nga mga operations, ang pag-require sa mga necessary nga test, and so on and so forth. Basically, mao naman to tong ginistoryahan pag mintag clinical practice. Pero tanawon na to si telehealth o telemedicine in terms of education. How can healthcare providers share information, share knowledge among themselves, especially knowing that naay mga lugar nga they lack specialists, no? Pag may mga tag-specialista, kanitong mga nigahin gid og time nga motuon sa specific discipline in medicine, which is unfortunately in some places walay ing-ani nga mga tao. So how can telehealth and telemedicine more bag bridge this kind of gap? How can specialists be able to share what they know, no? Share their knowledge, impart their knowledge into healthcare providers as well, pero doesn't necessarily have this specialization. Mo po natong tanawon kanang second part sa ato ang presentation. So let's start with spectrum of telehealth platforms and applications. So basically, ang ato ang gusto lang ma-subay din hino is asa nato ba makita, asa man ma-apply si telehealth and si telemedicine in a global setting. Okay, so mo na atong tanawon. So the global community is facing the digital transformation of healthcare with the integration of telehealth and telemedicine. Okay, so this is also made possible by the incorporation of electronic health records and the interoperable health information exchange. Okay, so ang pinakamurag kinahanglan nato ma-pick up dire is kato ang gisulod sa double quotation mark, the digital transformation of healthcare. No? If we have been very observant with how things are happening around us, I think we can all agree that indeed there is digital transformation of healthcare. Okay, and it's happening within our time. So we are lucky in a way that we get to see the transition between how healthcare was used to be and how healthcare is being transformed with the advent of technology. Okay? So this remarkable transformation is having an impact on countries around the world and for patients of all ages. So indeed, kaya ako na nasa ipos ha. Okay, so as I was saying, kanita ng changes, kani atong ginaingon nga digital transformation, dako ni siya og natabang, no? Especially katong sa mga nasod, mga country nga very limited ang ilang human resource. Atong gi-mention ganina, we are very much aware that in some places, in some countries, ang presence sa doctor is really lacking, no? Kulang na gani sila sa katong mga generalist na ginatawag, all the more sa mga espesyalista. So with the help of telehealth and telemedicine, the integration of technology into the provision of healthcare services, maskin ginagmay, mapangitaan or napangitaan og paagi nga katong mga needs sa ubang tao in some parts of the world ma-address to sila. Okay? So, mo nang pinakamurag obvious kaayo nga ma-observe na to with this digital transformation. So there are several international and national organizations with an interest in promoting telehealth, in sharing knowledge, and in assisting in the ongoing development of telehealth programs. So ako, I'll be very honest, before gihatag sa kuha ang task to handle the class, yes, na ako'y prior knowledge because in my study, sa ako ang pagskwela manggod, I am inclined into health, no? I believe Mr. Gulanes knows about it kay I had to arrange some meetings with the rehabilitation center kung asa didto nagatrabaho pod iyahang papa. So they know that I have been working with them for the purpose of my study. So somehow, na ako'y idea of things in the health sector and the integration of technology in this sector. Kaya lang, I have never encountered, not until I was asked to handle the class, nga naagid ay mga organizations who dedicate themselves in pushing for the full integration of technology in the provision of healthcare services. Okay, so karon I'll be presenting to you some of the known healthcare organizations internationally, and then we'll also look into nabayngani ng mga counterpart locally sa ato ang nasod. And medyo sad kay dili siya ing anak kakuan, dili siya ing anak pagyud ka strong diri sa Pilipinas, no? Ang culture nato for telehealth and telemedicine unfortunately is wala pagyud na purma. So kung tan-awon nato, very limited lang po kay ang resources nga makita nato locally, no? Pero naa. So I'll be presenting it as well in a bit. Okay, so for international organizations, ako na lang sila giisa-isa para dili kaayo mo malibog, no? So we have the International Society for Telemedicine and E-Health, which is nadiha ang ilahang website na link. So just in case you are interested, how does that look like? Mauni. So for any telemedicine or telehealth in general, any practitioner into this field, they can actually make use of these resources for lifelong learning, no? Para padayon silang mag-improve sa ilahang profession. Okay, from time to time bina-update man pud ang website to contain relevant contents. Okay? Another example is the American Telehealth Association. So na-mention na nato ni several times with our discussion. So in the United States, sila ang more primary organization that deals with the implementation of telehealth and telemedicine. Okay, so this is what the website looks like. Okay, so ilaha pang tagline, ATA is working to transform health and care through enhanced, efficient delivery. So that will only happen with the integration of technology. Okay, mas kung saan mo na siya og paningkamot na i-transform ang healthcare, without this technology, okay, kabalo man ta what these advanced technologies can offer in terms of becoming better, becoming more efficient, no? And then we also have the Swinfen Charitable Trust. Okay, so also in telehealth and telemedicine, we also have Medicine Sans Frontiers. And in the Philippines, we are lucky to at least have one, no? So this is actually through the efforts of the University of the Philippines. So naay ginatawag sa UP na National Institutes of Health or NIH. So sila at the moment ang murabag primary organization or association that actually deals with telehealth and telemedicine. Okay, so this goes to show nga, indeed, if we look around us locally and internationally, pagkatagid ka nga naagay efforts pod no buyag sa mga tao, especially coming from this sector, ang sector sa health, in really pushing for the full integration of telehealth, especially karon, given that we are facing this continuing COVID-19 pandemic, gipa-realize gid sa tuwa nga had we implemented telehealth and telemedicine long before, basin mas napadali sa ato ang mga bagay-bagay. And if you have heard of the news, kung naminaw mo sa balita, sa Pilipinas, ang current struggle karon in dealing with the COVID-19 pandemic is the availability of hospitals that can accommodate patients. Why? Tungod kay wala man proper education ang mga tao, pag makasinati sila og ginagmay na mga symptoms which is associated with the COVID-19 pandemic, for some, ang ilahang murabadayon og kanang pinakaunang mahuna-hunaan is to visit the hospital immediately. When in fact, pwede man nata to nga they just try to consult in the comforts of their home. Moagi sila og basically manawag sila hotline, or if they can use an existing application to undergo triaging, no, and screening. So if only na put into place na nato daan before the pandemic, nga aware ang mga tao nga pwede day ingani ang buhaton, things could have been a lot different, no? So dili unta bombarded kaayo nga ato ang mga healthcare facilities, but since dili man ta anad sa ingon ana, wala man na murabag na inculcate sa ato, dili man na second nature nato, mo na karon nga medyo nag-struggle ang ato ang gobyerno unsaon pag-accommodate sa mga lain-laing pasyente, especially with those COVID-19 cases. Now, going back to what all of this is about, again, ang ato ang gina-try og imply dinhi is that not only nationally, the efforts in pushing for the full implementation of telehealth in the global scale is really existing. Nagyo effort. In fact, collaborations among nations with this same goal is actually observable. Makita nato nga naagay efforts in collaborating. Okay? Which is why we are saying that with the implementation of telehealth and telemedicine, ang mga nasod na katumas ng inahanglan, especially for human resources, natabangan sila. Okay? And padayon silang matabangan if padayon pod nga pangusgan ang pag-implement sa telehealth and telemedicine. However, while it sounds very positive, no, nga naay collaboration, naay pagtinabangay, naapod gihapoy challenge or challenges nga makita. And one of the challenges obviously is time zone differences. Okay? Why is that? Because countries are located in different parts of the world which happens to have different time zones. Lisod or dili basta-basta ang collaboration. Okay? Pero for some, gitanaw nila ni as opportunity actually. Dili lang basta-basta kay ay hala, lisod di ay no kay ingani nga na. After recognizing na this is a challenge, people actually find a way to work around this challenge and turn the challenge into an opportunity. So, with that, ang nahitabo, there have been provision of a 24-hour coverage. It became possible. Nga naman, when providers in time zones that are 12 hours apart, night coverage in one time zone can be covered by providers 12 hours apart when it's daytime in their location. So, mura bag, di ba pag ma-expect manggug ka na pag nighttime, fewer ang mga tao nga nagalihok. Okay tayo sa case sa Pilipinas. Ang normal na to ating trabaho is between 8 to 5. So even healthcare providers, most of them are working in the same period of time. Doon na amang yun yung mga night shift. Di man pwede nga mawa tanan ang trabahante just because nilampas nag alas 5. But commonly, especially ka ng mga offices nga parts sa healthcare institutions, ang ilang oras sa trabaho is between 8 a.m. to 5 p.m. Beyond that, ang mabilin na lang dito sa healthcare institutions, katulad lang mga primary gyud. Like for example, at least someone from the billing, in kaso na yung mga gusto magpa-bill. At least someone from the different offices like social services. Ang ma-expect nimo nga magpabilin katong yung mga key individuals. So katong mga doktor sa lain-lain na mga departments, nurses, so katong yung mga healthcare professionals. Pero kung tan-awon nimo, lesser ang number nila compared sa daytime. Okay? Kaya ang sagad man gud pud na dagsa sa mga pasyente, daytime man. Kay daytime man na ay sagad mahitabo. Kay daytime man pud galihok ang mga tao. So sa ngayon na case, dili man nato malikayan. It's inevitable that something very crucial could happen even at night time. So kung for example, sa isa ka ospital na ay gidala nga pasyente niya, critical ang iyahang sitwasyon, makatabang gihapon si telehealth tungod kay kung naaman galing mga available healthcare professionals in the different side of the world, anang orasa, they can be contacted and they can be of service for that critical condition. Of course, naagid yapoy doktor nga mag-atiman dito sa physical na setting, sa actual na ospital, face to face with the patient. Pero if for example lang gyud manginahanglan og mga espesyalista which might be difficult to access anang oras, telehealth and telemedicine can be a good alternative, no? So this has been practiced actually, no? So for example, teleradiology programs like Nighthawk took advantage of the time zone differences using radiologists in the different time zones. So para 24/7 ang pag-provide nila sa services, kato, they utilize the different time zones para from time to time, kung naaman galing manginahanglan sa ilahang tabang, sa ilahang service, dili sila moabot sa point nga wala sila ma-provide tungod kay nangatulo ang tanan. Walay makaatiman sa ilaha. So, moto, they took it as an opportunity instead of just looking at it as a challenge. Okay, so ang mga radiologists nila is distributed across the different parts of the world. Naigikan sa Australia, naigikan sa United States, naigikan sa Europe. So singa na nga pamaagi, at least dili nga na kaayo ka kalisod gani nga mo provide og someone to attend to the needs of patients. Okay, at a certain time of the day, na may pwedeng kontakon. Okay, na may available for help. This is what the Nighthawk radiology program website looks like. This is very helpful, you know why? Because in a typical hospital setting, mao magud ni ang challenge. Like for example ha, simba ko mahitabo, namoy kaila or na, kamo mismo ma-involve og aksidente, simba ko palayo. Pag nahitabo ni siya during night time, let's say for example, gihadala mo sa ospital. So for example, gi-require mo nga mag CT scan. So sige, wala may problema. 24 hours man na ang pag-perform sa CT scan. Kaya lang, what comes after is where the trouble could arise. Pag human nag-perform sa CT scan, paggawa sa result, you do not expect specialist on this imaging to be available ana nga oras. So that's where the problem is. Maskin na kay resulta, but because walay maka-interpret, kay walay espesyalista ana nga oras, then that becomes a problem. So muhulat ba ka kanus mahimong available ang specialista? And that's where telehealth and telemedicine becomes very handy. So for those times nga walay makit-an nga specialista to interpret these results, basin naa sa laing nasod, basin naa sa laing lugar na pwede ma-contact. Okay, now, we have just proven that indeed there is collaboration nationally, internationally. Wala tayo question din ha. But the question that we might be interested in asking next is, where can these collaborations in telehealth and telemedicine be applied? Asa man gid sila actually nato makita, ma-observe. So mo na po natong isa-isahon, no? So first, for example, in addressing global health issues. So telehealth can be used to address global health issues as outlined by the World Health Organization or si WHO. Sila man ang responsable sa pag-tanaw holistically sa health concerns sa tibok kalibutan. So ilahan ang responsibilidad, no? So they are working with different organizations, different groups of people distributed across all countries nga part sa World Health Organization aron makakuha sila data. Okay, and with this data, ay sila mag-generate og mga reports, mag-come up sa ilahang analysis and so on and so forth para padayon nilang ma-perform ang ilahang task, which is again to ensure that everyone as much as possible is well taken care of. Okay, and then naabot tayo 17 Sustainable Development Goals. This is brought to us by the United Nations, no? So I know some of you who have been working on with projects, especially katong mga nag-join og mga contest somewhere, sometime, na-encounter na ninyo ni si Sustainable Development Goals, no? So maupod na ang ato ang ginaistoryahan diri karon. Okay? So in particular, mo ni ang mga relevant SDGs where telehealth and telemedicine can be very useful. No? So we have goal number 3, goal number 4, and goal number 17. So si goal number 3, ginaingon ana, to ensure healthy lives and promote well-being for all at all ages. So way laktaw, gikan sa bata nga mao palay paghimugso, mao palay paggawa sa iyahang mama hangtod sa kinatigulangan. Tanan na sila dapat maatiman. Goal number 4, ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. So, nag-mention og lifelong learning opportunities. Okay? Pasabot, dili tungod kay naka-eskwela na ka, nakahuman ka, kung unsa man na imong nahuman, mag-end na pod ang pag-learn. Mao na natin ginatawag na lifelong learning kay samtang nga buhi pa ang tao, dapat gapadayon gihapon sa pag-learn. Na mga butang na pwede pa nimo tun-an while you continue living your life, even if this is outside of the school already. So, applicable pud na sa telehealth o telemedicine tungod kay sa ato nang giingon no, na yung mga healthcare providers who doesn't necessarily have that specialization or very limited lang ang ilahang nahibalaan. In fact, naiuban siguro nga dili updated sa kung unsa na bag-o sa health sector. So with the implementation of telehealth and telemedicine, somehow ma-address ni siya. Kinaay may mga specialista na may mga up-to-date na pwede makashare sa ilang nahibalaan. And then, goal number 17, strengthen the means of implementation and revitalize the global partnership for sustainable development. So, murag, padayon ang effort aron nga katutan ng mga goals, padayon pong ma-address through global partnerships. Panagtabangay sa mga lain-lain nga mga organizations, associations, no? That's one, global health issues. Another area where telehealth and telemedicine can be applied, internationally speaking, is in addressing life-threatening infectious communicable diseases. So diseases can be endemic, epidemic, and pandemic. So I hope klaro sa ato unsay kalainan ani. When we say endemic, very specific to a very specific to a certain location. Like for example, a certain barangay, a certain community. That's what we mean with endemic. Epidemic extends on a larger scale. Like for example, isa ka country, that's epidemic. And then pag may tag-pandemic, cross-country na. That's what we are experiencing now with COVID-19. Okay, so magamit si telehealth for these concerns. Okay? So the spread of those diseases can be mitigated through rapid sharing of knowledge and appropriate interventions. So sa unsang paagi man ni nato makita, we are very much aware no nga for developing countries or for third world countries, we are far behind the efforts of mga first world countries. Daga na sila mga practices dito nga perhaps wala pa nato na try dire, dili pa available para sa ato. That's why with the implementation of telehealth and telemedicine, at least katong mga healthcare providers coming from first world countries can actually impart their knowledge so that it can be used by local healthcare providers in addressing these life-threatening infectious communicable diseases. Okay? One will learn from another. Okay, pareho raman gyapon og goal. Okay, nga as much as possible, malimitahan ang mga tao nga ma-expose sa sakit and matabang mga tao nga nasakit na gyud. That's it. Okay, so telehealth networks can be utilized in addressing these life-threatening outbreaks and the serious associated morbidities and mortalities. Okay, another area where telehealth and telemedicine can be applied, disaster response. No? Dili nato na ma-deny kay si Pilipinas, as we have seen or some of us as we have experienced, kapila ta sa isa ka tuig maigo og mga natural calamity, mga disaster, no? So during these times, the availability of healthcare services becomes unavailable or becomes impossible. Kay dili ba exempted ang mga healthcare facilities sa linog, sa baha. Dili ba amulikay sa ilahano. So apil na sila sa mga maigo. So kung maigo po sila apil, how can they still provide the services kung sila mismo nanginahanglan po sila tabang. So with telehealth and telemedicine, in the absence of local healthcare providers, in the absence of local healthcare facilities, katong mga panginahanglan nun sa mga tao medically, pwede gihapon ma-address. Okay, so mao na siya ato ang ginapasabot din ha. Okay? It can also be used for triaging, no? Particularly when the existing healthcare infrastructure is damaged or the medical issues become overwhelming for local provider. So mag-expect naman gud pud ta pag naay disaster daghan gud na og maapektuhan. Okay, so gikan sa mga ginagmay na mga samad-samad hangtod sa katong mga grabe na gyud kaayo nga mga issues. Okay, so sometimes, again, because local providers are also affected by the disaster, attending to the concerns of people can be overwhelming. So sa nga nga panahon, dakong tabang kung naay laing mga healthcare providers, even coming from distant places na maka-assist, okay? At least man lang sa pag-triage sa mga pasyente. Okay, to more effectively and efficiently use telehealth in a disaster, telehealth should be included in disaster preparedness planning. So, sakto pod kay kung wala man gud siya, kung di man gud jud siya appeal sa imong gina-expect nga mamahimong available during disasters, medyo gamay ang certainty nga makatabang gud siya sa tao tungod kay dili man andam. 'Di ba? Whereas kung apil siya sa plano, meaning kung ang mga tao responsable sa pagplano unsay sunod buhaton should a natural calamity, a disaster happens. Kung apil na sa ilang gi-consider nga dapat naatay ing ani nga mechanism para kung kintahay na ay disaster mo abot, dili maputol ang pag-provide nato sa healthcare services sa mga panginahanglan sa mga tao. So kabalo sila unsa na infrastructure ang kinahanglan, kabalo sila unsa na mga gamit ang dapat naa, kabalo sila unsaon pag-utilize sa ilang mga resources, both mga in-kind na resources ug labaw sa tanan ng ilang mga human resources. Kung wala man gud na apil sa plano, magkarakara pa. Just look at what we have been doing with COVID-19. Di ba? We cannot discount the effort of the government. Pero makita nato ba nga, we are not really prepared for this kind of situation. So, diha pa lang, makita nato nga, kung wala di ay naplanuhan, kung wala di siya gi-appeal sa initial planning for disaster preparedness, it might be nga pag moabot na gyud ang actual na disaster, dili ta ka siguro nga mamahimo gyud pud available ang healthcare services. Kay diha pa man paningkamutan nga ma-put up kanang nahitabo na ang disaster. So in addressing the concerns or the needs of people, na ay delay, and we cannot afford that, no? So it's very recommended nga i-appeal na gyud siya sa planning. Okay? With this, systems and the needed infrastructure can be deployed and quickly put in place for adequate responses. So in summary, there is a wide spectrum of ways to utilize telehealth, and that represents a continuum of care. No? So ang point is, with these different areas where telehealth and telemedicine can be applied, makita nato ang pagpadayon sa pag-provide og healthcare services, no? Ang pag-care sa mga tao. Now, let's look at how telehealth and telemedicine is helping in terms of education, case reviews, and simulation. So, aside sa itong ipang-mention ganina, no, ma-feel pod nato actually ang telehealth o ang telemedicine kung i-apply siya sa uban pag yung parts, sa ubang areas, which is mo na itong i-identify karon, especially with respect to education. So the benefits of telehealth and telemedicine transcends even to education. It goes beyond the clinical services, no? Dili lang kay mismong pag-perform sa mga clinical practices to help patients with their current illness. It goes beyond that. So appeal sa mga areas kung asa makita na to ang benefit or ang purpose or ang advantage sa pag-implement og telehealth o telemedicine sa education. Okay? Education, wala nagpasabot nga formal education like eskwelahan na ay teacher na ay estudyante. No, it doesn't have to be like that. Education in the sense na even simple sharing of knowledge, that's already education. So muna ito ang tanawon karon. When examined closely, there are two primary ways in utilizing telehealth and telemedicine healthcare knowledge sharing, no? Or in utilizing telehealth and telemedicine for healthcare knowledge sharing. So unsa man tong duha ka pamaagi? Education and case review. So sa may pasabot anang education and case review. Sa ato ang gi-mention ganina, it can be in the context of a healthcare provider sharing knowledge to another healthcare provider. No? So, ang isa sa nindot kaayo na example ani is the extension for community health outcomes. Si Project Echo, if you could still remember, in one of your activities, I asked you to read about Project Echo. So, si Project Echo is a very good example of a model using telehealth technologies for education and case reviews. Ginaunsa man di ay unsa man di naa sa Project Echo. If you could still remember, nag-mention tagamay ani during our lecture and of course gibasa ninyo hopefully sa inyong activity. Si Project Echo basically murabag naa siya gina-arrange na mga sessions among healthcare providers. So naay mga espesyalista nga mo hatag sa ilahang knowledge, mo impart sa ilahang knowledge, mo share sa ilahang expertise dito sa mga primary healthcare providers pod coming from rural areas para from time to time ma-update sila sa unsa nay bag-o, unsa nay mga kalahian sa mga pamaagi before and now para ma-upgrade ang ilahang skill set. That's why we have things like this. Okay? Project Echo is directed toward primary care providers related to common complex health problems. The goal is to improve the knowledge and confidence in managing patients with a spectrum of medical disorders. So muna basically ang purpose ni Project Echo. Okay? That's basically what education and case review is all about. Healthcare providers helping one another, sharing knowledge, seeing to it that healthcare providers who lack the knowledge, who lack the skills, can be helped. Para kato sila, ma-empower sila nga sa ilahang local na mga healthcare institutions, sa mga facilities kung asa sila na belong, they can actually be confident about what they can do to help patients. Muna ato ang pasabot din na sa education and case review. Another way is for simulation. No? So simulations have been used with high fidelity mannequins and virtual reality environments. Unsay pinaka makuha nato with simulation, it allows a safe environment to learn, reinforce training, and provide a safe environment to make mistakes and learn from those mistakes. Kaya hinumduman ninyo in one of our sessions, mention nato ni nga, very critical ang health sector tungod kay kinabuhi sa tao ang involved. So, they cannot afford to play with their patients. Dili nila pwede dulaan ang kaso sa ilang pasyente. So, before having any interaction with the patient, especially kung ang interaction involves an actual operation, dili dapat basta-basta ni buhaton. Dapat siguroon nga ang imuhang healthcare provider is really knowledgeable. Otherwise, ang kinabuhi sa pasyente, ang well-being sa pasyente ang makompromise. So, with simulation, healthcare providers can actually learn, can actually practice, and in the event that a mistake is done during these practices, walay angay kabalakan kay wala may kinabuhi nga makalas. Okay? So, unsa man pag-apply ang telehealth o telemedicine sa ingani nga pamaagi? Pwede nga naagi hapoy nag-assist nga specialista from somewhere looking at how healthcare providers in one place interact with this simulation systems. No? So, pwedeng, for example, kung ako to specialista, ako tong mas knowledgeable, na ako sa laing lugar, I'll just observe how you do things with the use of these mannequins. Kung ako'y ma-observe nga, kinahanglan ayuson, kinahanglan usabon, then I can comment on your performance at the end of it. Okay, para ikaw nga ni try, makita nimo nga, dili ko sayop, so dapat ang akong buhaton sunod ingani nga na. Okay? So walay kinabuhi ang nakalas. If you have been watching again series about health, so daghan man taglindot na mga series on health, no, kanang about doctors, makita ninyo na yung mga scenes wherein ang murag head na physician, head sa isa ka department, say for example cardiology department nga responsable sa kasing-kasing sa pasyente. Na yung mga scenes wherein inig perform adtong head kung siya ang in charge sa operation, na ay mga i-invite na mga interns. Let's say for example, mga soon-to-be doctors mag-observe. So, sa nga nga pamaagi, mura gihapon na og ingani atong ginabuhat with simulation. Pero walay angay kabalakan tungod kay katong mga interns, even if dili pa gyud sila ingana ka experience, pwede sila tagaan og opportunity nga sila mismo ang mubuhat sa katong buhaton dapat unta sa head na physician. Kay pag sa tinuod magud na kinabuhi, sometimes hesitant ka. Kung ikaw tong head physician, dapat siguroon nimo nga kung gusto nimo ang imong mga estudyante, imong mga interns maka-learn by allowing them to experience it themselves, sila ang mo perform sa isa ka step in the operation. Let's say for example, ang pagtahi sa samad, pwede man na siya. Kaya lang, wala tay guarantee lagi nga it will turn out positive or it will turn out negative. Nya kung in kaso it will turn out negative, naa nagitaw nga maapektuhan. Whereas kung sa simulation nato sa buhaton, bahalag masayop sila, wala tay angay kabalakan. Wala man tay madisgrasya, wala may mabutang sa alanganin. Okay? So that's it. So there are also other ways in which telehealth and telemedicine can be applied. So aside ato itong gi-mention, kay nag-ingon man ta nga primary ways to sila, there are other ways. And these ways we can actually consider also equally important. So unsa man to? Telementoring and telesupervision. So Experts can transmit their procedures or for education and training purposes. For students, in the case of those who are still studying medicine, or for other healthcare providers with less experience who are interested in applying these procedures to their patients. Like for example butang na lang nato, we are all doctors. Kamo mga doktor mo tanan. Ako doktor sad ko. Kaya lang, I was lucky, I have been exposed to many different cases. So, with this experience, I was able to gain a lot of new knowledge on how to apply things, which might not be true to all of you. Kintay, ang uban sa inyo very limited lang yun ang experience. So wala mo kabaloon sa mga lain-laing pamaagi. Ang gitulo sa libro, ingani ana. Pero wala pa mo kakita unsay mga lain pamaagi as applied in real life experience. So ako, being the one with more experience, pwede na ko i-share sa inyo through telementoring and telesupervision. Okay? So, sa inyong end, you can actually follow the procedure. Ako, magtanaw lang ko. I'll just be on the other side of the room. Muhatag lang ko sa ako ang mga suggestions, ako ang comments. And then, kamo na bahala mo apply sa kung sa tong na-learn, kung sa tong gi-impart sa inyo nga bagong knowledge. Okay, that's telementoring and telesupervision. So furthermore, real-time supervision can be provided virtually by having experts available to view and advise others when doing the procedure. So katotong giingon ganina, na ay expert nga mag-monitor lang. Kumusta man ang imuhang pag-implement sa procedure? Nasunod ba? Kung wala, asa dapit nagka-problema? How do we address that one? And then eventually, mahuman gyud og sakto ang procedure. We also have teleconsultation. So it maximizes the use of video conferencing to evaluate, diagnose, and assist in management of patients with experts from other countries. Ang kalainan ato ganina, kanimanggod, dili kinahanglan nga naa nagyoy pasyente. So murabag, think of it as a preparation. Ang mga healthcare providers nangandam, sa ilang pagpangandam, gusto sila makabalo og laing pamaagi should a certain case will be present in their healthcare institution. Murag nagpatudlo sila daan before pa man na moabot na pasyente. Teleconsultation, on the other hand, is a little different because this is where a patient is already involved. Okay, so ang isa ka healthcare provider, mangayo og assistance sa laing healthcare provider, especially coming from someone with more experience or someone that is a specialist in that field. Okay? So can also be used to facilitate specialty interaction from a medical center to providers and their patients in distant rural or remote locations in the same country. So for example, masig sa Davao lang nato tan-awon or sa Davao region, isa ba ang pinakadako na healthcare facility nga naata, pinaka murabag equipped government healthcare facility, di ba we have SPMC. The rest of the healthcare facilities, especially government ones, nga naa sa Davao region, dili ing anak ka well-equipped in terms of devices, in terms of tools, in terms of human resource. So, pwede, in the case wherein a patient needs to be looked into, pero walay specialista nga makatanaw, then teleconsultation can be a good option. We also have web-based second opinion. So asynchronous systems have also been applied for the evaluation and management recommendations as well as second opinion from experts in support of primary care providers. So familiar man siguro to sa concept sa second opinion. Kung dili ka certain or if you are having second thoughts with the diagnosis provided by a physician, you can actually seek for second opinion. So sa second opinion, it's either i-confirm tong unang diagnosis or maghatag og laing diagnosis, which can either be worse or better. Mo na naa sa second opinion. So we can do that with telehealth and telemedicine through the use of web-based applications. And then we also have a thing called mHealth and Internet of Medical Things. No? So we are used to the concept of IoT, Internet of Things, pero very generic. Anything that can be set to communicate with one another electronically, muna ito ang ginahisgutan sa Internet of Things. But we have a more specific subdomain. We have Internet of Medical Things. Ang ato ang concern din allowing medical tools and medical equipments to communicate with one another through the internet. That's what we meant with Internet of Medical Things. Okay, so a multitude of mobile phone applications have been developed to build upon cellular phone networks. Okay, so that basically ends our presentation. Medyo taas-taas po dyan, no? I hope you still have the energy. Naabay mga pangutana, naabay part sa ato ang gidiscuss nga wala na klaro or you wish to be clarified with?
Wala po, sir.
So nakasunod ba ang tanan? Klaro so far ang ato ang gihisgutan?
Yes, sir.
Okay, sige. Naay mga pahabol na pangutana? Now, if wala, so again, I won't hold you for too long. Pag ginhawaon sa tamo today, no? So after this, after we have our lecture, you are free to do whatever things you wanted to do with the remaining time that we have. But for those na wala pa, again, take sa quiz, there are 4 of them. Please do it now. No? Kay antod 11 lang to ang quiz na ko giset. Okay? So if wala na questions, let's end our lecture here. So I am dismissing you. I will meet you again. We still have Monday. No, good thing na move ang exam kay katong Monday ba nagsige na kog announce nga mag-exam ta sa Wednesday ug sa Thursday. Di ay to gi-move ang exam so natagaan pa ta, nalugwayan pa ang ato ang schedule. So napatay time nga maka-discuss pa gid further about certain topics and maka-review og sakto, no, in preparation for the exam. So I will still be meeting you on Monday next week. Okay? So that's it for today. Kung naaman galing mga announcement, palihog na lang yung kog check sa ato ang Google Classroom from time to time. Okay? So you are all dismissed. Have a wonderful day ahead.
Thank you, sir.